Cancer. Causes, types, symptoms, and treatments. Cancer is a complex group of diseases characterized by the uncontrolled growth and spread of abnormal cells. If not managed effectively, it can result in significant morbidity and mortality. Cancer can arise in almost any part of the body and has many different forms, each requiring specific treatment strategies. This video drills into the causes, types, symptoms, and treatments of cancer, providing valuable insights into this pervasive disease and the ongoing efforts to combat it. What is cancer? Cancer begins when genetic mutations disrupt the normal processes of cell growth and death. These mutations cause cells to grow and divide uncontrollably, forming masses called tumors. Not all tumors are cancerous. Benign tumors do not spread to other parts of the body, while malignant tumors invade surrounding tissues and can metastasize to distant organs. Causes of cancer. Cancer is caused by a combination of genetic and environmental factors. Understanding these causes can help in developing preventive strategies and early detection methods. Genetic factors. Genetic mutations can be inherited from parents or acquired throughout a person's lifetime. Some genetic factors include inherited mutations. Certain inherited genetic mutations can significantly increase the risk of developing cancer. For example, BRCA1 and BRCA2 gene mutations are associated with a higher risk of breast and ovarian cancers. Acquired mutations. These occur due to environmental exposures or random errors in DNA replication. Most cancers result from acquired mutations rather than inherited ones. Environmental factors. Environmental exposures can damage DNA and contribute to cancer development. Key environmental factors include tobacco smoke. Smoking is a leading cause of lung cancer and is linked to many other cancers, including mouth, throat, and bladder cancer. Radiation. Exposure to ionizing radiation, such as from the sun, UV radiation, or medical imaging, X-rays, can increase the risk of skin cancer and other cancers. Chemicals. Exposure to certain chemicals and carcinogens such as asbestos, benzene, and formaldehyde can cause cancer. Infections. Some viruses and bacteria such as human papillomavirus, HPV, hepatitis B and C viruses, and Helicobacter pylori are associated with cancer development. Lifestyle factors. Lifestyle choices can influence cancer risk. Key lifestyle factors include diet. A diet high in processed foods, red meats, and low in fruits and vegetables can increase cancer risk. Physical activity. Regular physical activity can lower the risk of certain cancers, such as breast and colon cancer. Alcohol consumption. Excessive alcohol consumption is linked to cancers of the mouth, throat, esophagus, liver, breast, and colon. Types of cancer. There are more than 100 different types of cancer, classified based on the tissue or organ of origin and the type of cells involved. Some of the most common types include carcinomas. Carcinomas are cancers that arise in the epithelial cells, which line the inside and outside surfaces of the body. They are the most common type of cancer and include adenocarcinoma, originates in glandular tissues such as the breast, prostate, and colon. Squamous cell carcinoma arises in the squamous cells, commonly found in the skin, lungs, and esophagus. Basal cell carcinoma, a type of skin cancer that begins in the basal cells of the epidermis. Sarcomas. Sarcomas are cancers that arise in the connective tissues, such as bones, muscles, fat, and blood vessels. They are relatively rare and include osteosarcoma, a type of bone cancer. Liposarcoma, cancer of fat tissue. Leiomyosarcoma, cancer of smooth muscle tissue. Leukemias. Leukemias are cancers of the blood and bone marrow, characterized by the uncontrolled proliferation of white blood cells. Types include acute lymphocytic leukemia, ALL, rapidly progressing cancer of immature lymphocytes. Chronic lymphocytic leukemia, CLL, slowly progressing cancer of mature lymphocytes. Acute myeloid leukemia, AML, rapidly progressing cancer of myeloid cells. Chronic myeloid leukemia, CML, slowly progressing cancer of myeloid cells. Lymphomas. Lymphomas are cancers of the lymphatic system, which includes lymph nodes, spleen, and other immune tissues. Types include Hodgkin lymphoma, characterized by the presence of Reed-Sternberg cells. Non-Hodgkin lymphoma, a diverse group of lymphomas that do not have Reed-Sternberg cells. Myelomas are cancers that arise in plasma cells, a type of white blood cell found in bone marrow. The most common type is multiple myeloma, a cancer of plasma cells that can affect multiple bones. Central nervous system, CNS cancers. CNS cancers arise in the brain and spinal cord. Types include gliomas, tumors that arise from glial cells such as astrocytomas and oligodendrogliomas. Meningiomas, tumors that arise from the meninges, the membranes that surround the brain and spinal cord. Symptoms of cancer. Cancer symptoms vary widely depending on the type, location, and stage of the disease. Common symptoms that may indicate cancer include unexplained weight loss, significant weight loss without changes in diet or exercise. Fatigue, persistent tiredness that does not improve with rest. Fever, unexplained fever that does not have an apparent cause. Pain, persistent or unexplained pain such as headaches, bone pain, or abdominal pain. Skin changes, new or changing moles, skin lesions, or jaundice, yellowing of the skin. Symptoms based on cancer type. Breast cancer, lump in the breast, changes in breast shape, nipple discharge, or skin changes on the breast. Lung cancer, persistent cough, coughing up blood, shortness of breath, or chest pain. Colon cancer, changes in bowel habits, blood in the stool, abdominal pain, or unexplained weight loss. Prostate cancer, difficulty urinating, blood in urine, or pelvic pain. Skin cancer, new or changing moles, sores that do not heal, or changes in skin color. Diagnosis of cancer. Diagnosing cancer involves a combination of medical history, physical examination, imaging tests, laboratory tests, and biopsy procedures. Medical history and physical examination. A thorough medical history and physical examination can provide valuable information about potential cancer symptoms and risk factors. Imaging tests. Imaging tests help visualize the internal structures of the body and identify abnormal growths. Common imaging tests include X-rays, commonly used for diagnosing bone cancers and lung cancers. Computed tomography, CT scan, provides detailed cross-sectional images of the body. Magnetic resonance imaging, MRI, uses magnetic fields to produce detailed images of soft tissues. Ultrasound uses sound waves to create images of internal organs. Positron emission tomography, PET, scan uses radioactive tracers to detect cancer cells. Laboratory tests can detect cancer markers and provide information about organ function. Blood tests measure levels of specific proteins, enzymes, or tumor markers. Urine tests detect cancer markers or abnormal cells in the urine. Biopsy. The definitive diagnostic test for cancer involves taking a tissue sample from the suspicious area and examining it under a microscope. Staging and grading of cancer. Once cancer is diagnosed, it is important to determine its stage and grade to guide treatment and predict prognosis. Cancer staging. Staging describes the extent of cancer spread within the body. The most commonly used staging system is the TNM system. T, tumor. Size and extent of the primary tumor. N, nodes. Involvement of regional lymph nodes. A metastasis. Presence of distant metastasis. Cancer stages range from I, early stage, to IV, advanced stage. Cancer grading. Grading describes the appearance of cancer cells under the microscope and indicates how aggressive the cancer is. Low-grade cancers resemble normal cells and tend to grow slowly, while high-grade cancers look abnormal and grow rapidly. Treatment of cancer. Cancer treatment depends on the type, stage, and grade of cancer, as well as the patient's overall health. Treatment options include surgery. Surgery involves the removal of the tumor and surrounding tissues. It is often the primary treatment for localized cancers. Curative surgery aims to remove all cancer cells and achieve a cure. Palliative surgery relieves symptoms and improves quality of life in advanced cancers. Radiation therapy. Radiation therapy uses high-energy radiation to kill cancer cells and shrink tumors. It can be used alone or in combination with other treatments. External beam radiation delivers radiation from outside the body. Internal radiation, brachytherapy, places radioactive material inside or near the tumor. Chemotherapy. Chemotherapy uses drugs to kill cancer cells or stop their growth. It can be used as a primary treatment or in combination with surgery and radiation therapy. Systemic chemotherapy. Drugs are administered orally or intravenously to reach cancer cells throughout the body. Regional chemotherapy. Drugs are delivered directly to the tumor site. Targeted therapy. Targeted therapy uses drugs that specifically target cancer cells while sparing normal cells. It is often used for cancers with specific genetic mutations. Monoclonal antibodies bind to specific proteins on cancer cells and inhibit their growth. Tyrosine kinase inhibitors block enzymes that promote cancer cell growth. Immunotherapy. Immunotherapy stimulates the body's immune system to recognize and attack cancer cells. Checkpoint inhibitors block proteins that prevent the immune system from attacking cancer cells. CAR T-cell therapy modifies a patient's T cells to recognize and destroy cancer cells. Hormone therapy. Hormone therapy blocks or reduces the production of hormones that fuel certain cancers, such as breast and prostate cancer. Anti-estrogens, used for hormone receptor-positive breast cancer. Androgen deprivation therapy, used for prostate cancer. Stem cell transplant. Stem cell transplant replaces damaged bone marrow with healthy stem cells. It is often used for blood cancers, such as leukemia and lymphoma. Autologous transplant uses the patient's own stem cells. Allogeneic transplant uses stem cells from a donor. Prevention of cancer. Preventing cancer involves reducing risk factors and adopting healthy lifestyle habits. Avoid tobacco. Quit smoking. Smoking cessation reduces the risk of lung cancer and other cancers. Avoid secondhand smoke. Minimizing exposure to secondhand smoke reduces cancer risk. Healthy diet and physical activity. Balanced diet. Eat a diet rich in fruits, vegetables, whole grains, and lean proteins. Regular exercise. Engage in regular physical activity to maintain a healthy weight and reduce cancer risk. Limit alcohol consumption. Moderation. Limit alcohol intake to reduce the risk of cancers of the mouth, throat, liver, breast, and colon. Sun protection. Sunscreen. Use sunscreen with a high SPF to protect against UV radiation. Protective clothing. Wear hats, sunglasses, and long-sleeved clothing when exposed to the sun. Vaccinations. HPV vaccine protects against human papillomavirus, which is linked to cervical, anal, and throat cancers. Hepatitis B vaccine reduces the risk of liver cancer. Early detection. Regular screenings, such as mammograms, pap smears, colonoscopies, and skin exams can detect cancer early when it is most treatable. Cancer is a complex and multifaceted disease that requires comprehensive understanding and management. By recognizing the causes, types, symptoms, and treatments of cancer, individuals can take proactive steps to reduce their risk, seek timely medical intervention, and improve outcomes. Continued research and advancements in medical treatments offer hope for better prevention, early detection, and effective therapies. Awareness, education, and a commitment to healthy lifestyle choices are key to combating this global health challenge and ensuring a healthier future for all. If you received value from this video, please like and subscribe to the channel.